Hello everyone. Our project here is COVID-19 predictive analysis. This comes under pandemic disease domain. My team members are Shreya Shekhar, Santosh Kumar, and Sasida Ratlari. So in the past 2 years, COVID-19 has impacted all of our lives with a lot of disturbing events and deaths all around the world. With the new variant Omicron arising, we thought an analysis of COVID-19 might be helpful during this tough situation. So we took the dataset from Belgium government website, which had complete dataset starting from March 2020, that is the beginning of the pandemic, until September 2021, around the time which we chose this project. Our objective here was to do a descriptive analysis on the Belgium dataset of all age group people by merging daily data to visualize the relationship between the positive cases, increase in vaccination counts, deaths, and hospital data. To implement predictive analysis on our data using linear regression for analyzing the after effect of increase in vaccinations on the count of positive cases. So the data description part, where it consists of dates of all the cases, total number of patients in the hospital, total number of patients in ICU, respiratory support, ECMO, new patients discharged in the hospital and got hospitalized, total number of positive cases and total number of tests people have taken, total death count, and different categories where region, vaccine brand categories, and the various doses for each vaccines, where like 2 doses for some vaccines and 3 doses for the other vaccines. These categorical columns were obtained during the preparation process, about which my teammate will explain.
Hello guys, I'm Shreya. We'll talk about the data preparation. So now when you're thinking about it, you have the data set. Like our data set is like 4 individual data set: hospitalization, mortality, tests, and vaccination. But our data set was raw. We do not have proper data in it. So we had to do a lot of data cleaning and then work on the model. The whole process is crispier process. It's 6-phase model, which include business understanding, data preparation, modeling, evaluation, and the deployment of the model. So business understanding here is the target population. The target population is nothing but the general public, community members, healthcare workers, and the vulnerable population. We are doing this project so that they'll be benefited by that, of the people of the Belgium. So data understanding. So we know that the data we have is of the hospital, mortality, tests, and vaccines. So we have to prepare the data for that. We have to handle the missing value status. We have to fill in the null values with a constant value or a zero, depending upon the data detail. Next is cleaning the data set. So removing the duplicate, unwanted columns, and dropping unwanted rows. The next is the categorical data conversion. There is object data types which cannot be used for EDA part. So we need to convert the object data types into categorical values. The next is the standardizing data. Standardizing data is like there's a high range of values. So we need to standardize the data and using a standard scaler and make it into a stable standard set of variables. Next is outliers. COVID-19 has higher range of outliers because the value, one day it is high, the COVID-19 data, there's number of cases are high, the other day it's very low. So there's a high range of outliers, and which gave us an RMSE about 5,000, which we had to get rid of. So now we have a RMSE value of 0.9, which is very good, and we got reduced it by removing the outliers. Next is the explorative data analysis, which is visualization of the data set. We have done the visualization of data set using a lot of parts. So about which, one sec. So first is a scatter plot between the count and test or positive. That's the end game of ours. So the count of vaccination versus positive cases. The next is this is just a scatter plot between the whole data set. This is a bar plot, which shows us the brand and dose categories. The next is a region versus test. This is a region versus count. And this is a heat map. And this is the number of people who die with the tests, the person who get COVID positive. The next is, we've spoken about already the data preparation. The next is linear regression, about which my teammates will talk about.
Hi, hi all. So the predictive, as a predictive modeling part of this project, so we have come up with a simple linear regression model, which is concerned about predicting the number of positive cases with the increased number of vaccine count. So the dependent variables here will be the the positive test cases, and the independent variables are the number of counts of vaccine given to the public. So with the available data, whatever we have processed till now, so completing all the EDA process. So we have split it into a test and train data with 70-30%, and then we have close to 3939 records in the train set, and then 1689 records in the test data set. So which is ideally good for any predictive modeling to be done. So once the linear regression model is applied on the available data, train and test data set, so we have the coefficient and intercept count, and then the standard errors as evaluation of model standard evaluation model of linear regression model. So the values of t static and standard errors were around 0.01, and then the t static is 5.25, which clearly identifies that the variance of the data coefficient signifies that there is a dependence on dependent and independent variables will vary according to the values of our linear regression model. So, and finally, when we actually predict the values of future y variables, so we had seen a clear decrease in the number of positive cases for increased count in the vaccination. That's where we can see the graphs and models. So the predicted values of positive test cases has become very low when there is an increase in the count of the vaccines. So that's where we actually did better, and then the model is also predicting the good values of this. So the efficiency of this model can be calculated by using the mean absolute error and mean square error and root mean square error, which are generally employed to identify any linear regression model. So that's where we ended up with the values of 0.4 and 0.8. And the conclusion part will be taken over by Ceci.
Hi guys, in this project our main objective is to perform predictive analysis on measured daily COVID-19 data of Belgian people of all age groups. We have taken the data from the Belgian government website, which is more accurate. The dataset we have has its unique data. The datasets we have like hospitalization, vaccines, mortality, and COVID test related information. For the data preparation, we removed some null values in the dataset. After that, we have done analyze. We have got the good results. The final we got like the people who takes the more vaccinations, then we got the less positive cases. That's it. The future scope is like nowadays Omicron is more spreading in the country, across the country. The we can analyze the people who takes the which vaccine and who are getting the less positive cases. Like we can analyze which vaccination is effective for the Omicron cases. We suggest you like all to be get vaccinated and be safe. Thank you.
Thank you all.